Okay, let's dive right into some material that really shifts how we can think about a fundamental aspect of human interaction, what often gets labeled as resistance.
Yes, we're looking at a summary today from a supervision course
Hmm.
led by John Frederickson and Yuval Alon.
Exactly, and it offers a perspective that sort of moves us away from seeing resistance as just, well, obstructive or difficult.
Right. Towards understanding it within the context of relationship itself. It's a key shift.
Yeah, absolutely. The mission here for us and for you listening is to really grasp why resistance makes profound sense and how approaching it with empathy, understanding,
And crucially, a deep faith in the other person's underlying desire to connect or heal.
that's it, how that faith can utterly transform how we respond, seeing it maybe as an invitation, not, an impediment.
It's a subtle shift, but really powerful. And it requires looking inward, wouldn't you say? As much as outward.
Which, well, that brings us to a really important starting point from this material. Acknowledging our own emotional reactions feels very honest, very human.
It is. What's emphasized is this fundamental truth. Anyone in a close relationship, and certainly therapists with patients, will have emotional reactions. It's unavoidable.
Feeling something, frustration, maybe care, even anger, that's just part of being human, right?
Exactly. The critical distinction they make isn't having the feeling itself. The problem, and where you lose clarity and freedom, therapeutically speaking, is acting from that feeling instead of just staying with it, observing it.
Right. There's that quote they highlighted, something like, I'm angry because I care and want the patient to do well. That's not a problem.
But if I act from that instead of staying with the feeling, I lose clarity. That's the core of it.
So freedom comes from allowing the feeling to be there without being, compelled to act it out immediately.
Precisely. You let it inform you rather than drive you blindly.
And I can totally see how acting from that unprocessed reaction, well, it could easily lead into that next dynamic they discussed, the passive patient active therapist trap.
Absolutely.
Mm.
It's a common pull. When someone is withdrawn or passive, it feels, well, uncomfortable, maybe awkward.
Yeah.
And a common, often unconscious reaction from the other person, the therapist, say, is to become overly active, to fill the void, or maybe try to fix the discomfort.
So you might start leading too much, offering loads of suggestions, trying to rescue them from their silence or whatever difficulty they're having.
Yes, exactly. Or sometimes the opposite happens. You detach mentally because the passivity feels frustrating, maybe even hopeless after a while.
Either way, even if the intentions are good.
Right. Good intentions aren't always enough. The interaction shifts away from being collaborative, from a relationship between two people, towards one where one person is leading or doing to the other, rather than being with them.
So an engaged stance, as this material describes it, it isn't about suppressing your feelings or becoming passive yourself.
No. It's about feeling and observing and thinking, all at once, really. Staying present in the relationship dynamic itself as it unfolds.
Having your reaction, but not being totally consumed by it. So you can stay curious about what's actually happening between you both.
That's it, maintaining that internal space for reflection, even when things feel difficult.
Okay, so now, here's where that reframe comes in that I found really powerful, this idea of pressure.
Ah, yes, re-seeing pressure, not as forcing, but as an invitation to connect.
Tell us more about that. How does that work?
Well, this point is really central to understanding resistance relationally. Why does someone shut down? Why do they resist opening up?
Okay.
Often the summary suggests they're hiding their mind because they're afraid, deeply afraid.
Afraid of what specifically?
Afraid of being judged, maybe dismissed, ignored. Fears that usually echo past relationships where expressing themselves felt unsafe or led to bad outcomes.
So they're kind of repeating an old pattern, protecting themselves now based on past hurts.
Exactly. They're doing to themselves, in a way, what was done to them. So the resistance isn't just stubbornness, it's protection born out of that relational fear.
Makes sense.
And the crucial step, according to this material, is that before you can extend an invitation to connect differently, that protective pattern first has to make emotional sense to the person. They need to see why they're hiding.
Ah, okay, so you don't just jump to the invitation. You first help them see the pattern.
Right. And that's where those specific examples of interventions from the summary come in. They're ways of gently highlighting that protective dynamic in the moment.
Like those phrases, these sound like your mother's thoughts, and what are yours?
Yes, or when we hear your mother's thoughts, we can't hear yours. It points out the conflict.
Or even more directly, can this be a way your mother's voice still decides for you? It really highlights that internal struggle, the past voice versus their own potential voice.
And once that conflict starts to become clearer, starts to be felt, then comes the invitation.
And it's not a demand, right? Not stop resisting.
No, it's an offering, a chance to step into something different. The material uses that beautiful example. Would you like us to follow your thoughts and wishes so you can feel them more clearly?
Ugh, that phrasing is so different. It's not accusatory at all. It's collaborative, respectful.
Yes. And it focuses on their internal experience, their own thoughts and wishes.
It speaks directly to that hidden part inside, doesn't it? The part that actually wants to be known, that wants their own feelings to matter.
Exactly. It speaks to their healthy wish. And this whole process, this gentle invitation, helps build their capacity, their emotional muscle to live from their own mind and wishes rather than being run by those old fears and protections.
And this really brings home that core insight we started with. Defenses, what we call resistance, they make perfect sense, but specifically within a relationship context.
This is the big shift, really. We stop seeing resistance as just a problem with the person, something inherent in them, and start seeing it as a logical adaptation. Maybe unhelpful now, but logical, developed because of their relational history.
Like that simple explanation from the summary.
The patient wants to express herself, but is afraid. That's why she shuts down.
Yeah, just saying it like that. It reframes everything, doesn't it? The shutdown isn't just opposition, it's fear, expressing itself relationally.
Understanding that relational logic, seeing defenses as these protective responses to past emotional danger in relationships, it allows us to relate to the whole person. We see the scared part and the part that deep down wants to connect.
And that changes our response completely. Instead of reacting to the defense with our own frustration,
We can respond with curiosity, with an invitation. Instead of just interpreting the behavior from a distance, we're trying to connect with the person behind it.
think about that example they gave. If someone was constantly judged for having opinions their whole life, it makes complete emotional sense, it's logical, that they would hide their mind when asked what they think. Even in therapy, a new relationship.
It's like having this moment of, oh, of course. Of course you developed this way to protect yourself. When the resistance makes emotional sense to us.
We stop fighting it internally. You don't take it so personally. You understand where it came from.
And when you stop fighting the resistance, you can actually start working in the relationship itself, helping the patient gently explore and maybe, eventually, let go of those old hiding patterns.
Because you're not just seeing the fear anymore. You're also seeing and speaking to their healthy core, that wish to be seen, to connect authentically, to heal, to live from their own true self.
And this, according to the source material, is how a truly healing alliance gets built. With clarity about how the past is playing out now, with deep empathy for the person caught in those patterns, and with this moment-to-moment awareness of how the past is showing up right here between you.
All rooted in that fundamental faith in the patient's own wish to heal.
Exactly. That faith is key.
The summary also included some really practical ways to put these ideas into practice, which is helpful. There's a suggested task of the week for you, the listener, to reflect on these concepts in your own interactions.
Yes, some guiding questions to help you think relationally when you encounter conflicts or resistance.
Like asking yourself, how does this conflict affect our emotional closeness?
And what might the person I'm interacting with be afraid of in being close to me right now?
And crucially, that core question, how does this person's resistance make sense in our relationship and maybe in their other relationships too?
Yeah, these questions really push you towards that deeper relational understanding we've been exploring.
And for those who want to, go even deeper with this kind of relational work, the summary also mentioned an opportunity.
Ah, yes, the invitation to the summer practice group with Yuval Alon.
Right. It sounded like it's designed as a focused practice group to really deepen clinical skills in this specific approach, learning in a small group.
Yeah, the details mentioned were starting June 19th, running for 7 weeks. It's every Thursday for 2 focused hours. And it involves practicing from both therapist and patient perspectives, which sounds interesting.
Getting both sides.
Exactly. And the focus is really on applying these principles we've talked about, working with specific examples, understanding transference, working in the relationship, identifying resistance relationally, and helping the person feel their internal conflict instead of the therapist sort of taking it over.
Okay. So bringing this all together then, This deep dive into the summary from Fredrickson and Alon's supervision course, it really offers a profoundly different lens on resistance.
It really does. It teaches us, I think, to see resistance not as a personal attack or just an obstacle to get around, but as a meaningful communication, a protective story being told, right there within the context of relationships, past and present.
And understanding its relational logic, that's the key. It allows us to move from reacting, maybe with frustration, to responding with deep empathy, genuine curiosity.
And that crucial invitation to connect differently, all built on a fundamental faith in the other person's capacity, their inherent wish to move towards healing and wholeness.
It really calls us to examine our own stuff too, doesn't it? Our own reactions, to stay present in those difficult moments with clarity, with compassion.
And ultimately, to see resistance not as something to fight or conquer, but maybe as a kind of guide, pointing towards where the healing really needs to happen right there in the connection between people.
So here's something to maybe leave you with, building on all this. If resistance is so often a form of protection, right, born out of past relationships, what might actually happen if we met that protection not with impatience or trying to break it down, but with genuine curiosity, curiosity about the vulnerable, maybe hopeful part it's working so hard to shield, something to mull over?